I would say Dr. Rutledge actually brought this surgery, and it's a kind of revolution and a big help to bariatric surgeons, I would say. To the patients it's good, but even better for the bariatric surgeons. You know why? Because we can have a sound sleep. If my patient is comfortable, safe, then we are happy. So it has made the lives of not only the patients good, but the bariatric surgeon's life has totally changed with this kind of procedure which Dr. Rutledge actually brought it into the picture in 1997 in US. Because the concept has totally changed. Earlier it was all about restriction. Because the concept was that these obese patients, they eat too much. So kind of put them to jail. Don't allow them to eat. So they will automatically, restrict them. But it's a law of nature. How much you can restrict someone? There has to be a limit of restriction. If you restrict too much, then that person would cheat you. So it's your brain. Your brain starts cheating you. If you restrict too much, you have nausea, vomiting, you cannot eat, then what will you do? You'll select something at least which goes down easily. So, soda pops, Pepsi, Coke, coffee, then ice cream, puddings, all those things, they will go down. So, because your brain needs calories. So that is the reason why these patients, they cannot eat, go into depression, have a lot of nausea, vomiting, and then they kind of get pushed towards soft calories and ultimately start gaining weight. And they cannot eat healthy because it has been too tight inside. So about the MGB design, why I call it a revolution, because the pouch is big. And in the beginning, the Roux-en-Y doctors would not even look at this procedure because it looks like like the way you are eating now, it's only 8-9 days. So how can you lose weight if you're eating? But it's not that we totally want to stop eating to lose weight. But all you need is a moderate amount of diet and a moderate amount of absorption. So it's not only the volume actually. Your body was absorbing too much. So with the bypass thing, now your body is pushing out the oils and fats. So it's a kind of balance. Eating moderate amount and absorbing not too much. So that's what brings you back to a normal person. So then you would be like any other normal person who can easily maintain his weight. Whenever you want, you can get it down by 5 kilos, or you can increase your weight. But those things, the feeling of not having eaten anything, getting into depression, then trying the wrong things, you will not have that because you can eat. Whatever you want, you can eat. So then you get satisfied. And then the mechanism is also a little bit different in MGB. The food is right away going into the intestine without any kind of mechanical obstruction. There's no band, no sleeve. The outlet is 5 centimeters. Food is going down into the intestine, but the intestine becomes full after getting a moderate amount of food because the walls of the intestine are very thin.
Correct.
So once it distends, it dilates, then it sends a signal to your brain. And then you stop. So this restriction is actually functional. It's not mechanical obstruction. So if you feel full, then you stop. So that's how it's a kind of luxurious procedure. So you can start eating early